Hi, I'm Joe Roth. At New Jersey Sharing Network, we're committed to saving and enhancing people's lives through organ and tissue donation and informing people about our life-saving mission. That's why we're proud to support programming produced by the CAUCUS Educational Corporation and their partners in public television.
This special edition of One-on-One with Steve Adubato is brought to you from the Tisch WNET studios at Lincoln Center. Funding has been provided by Bank of America. Life's better when we're connected. New Jersey City University. NJCU. Success spoken here. ADP, a comprehensive provider of human resources technology and services. The Russell Berry Foundation. PSE&G, committed to improving New Jersey's economy and strengthening its communities. QualCare Inc., a managed care company administering health plans that care about your health care. And by New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation. Promotional support provided by The Record, North Jersey's trusted source, and NorthJersey.com. And by NJBIZ, all business, all New Jersey.
This is One-on-One. I'm an equal American just like you are.
The jobs of tomorrow are not the jobs of yesterday.
Look at this. You got this?
Here it is, man. Look at that.
Life without dance is boring.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
Do you enjoy talking politics?
No.
People call me because they feel nobody's paying attention.
Our culture, I don't think, has ever been tested the way it's being tested right now.
Such a good question. High five.
I love this job. Not just because we are at this great Tisch WNET studio here in the heart of New York City, but we also have great guests like Adrian Carrasquillo, who is the editor of Latino coverage at BuzzFeed News. By the way, for those who don't know what BuzzFeed is,
BuzzFeed's a social news and entertainment site. You know, it was first sort of came up when people got a lot of attention for cat photos and videos and stuff like that. And it's a site that has added news and added a lot of political coverage and things like that to, and obviously cover the 2016 election.
All right, Latino coverage.
Mm-hmm.
How many Latinos are there in the United States?
There are 50 million, you know.
How many are eligible to vote?
There's going to be about 27 million that are going to be like eligible. In 2012, it was about 11 million that voted.
It's growing.
And yeah, and this year there's expected to be about 13 million that will vote.
So, as we were doing this program in May 2016, although after and maybe even after the election. So here's my question. The connection between Donald Trump and the Latino community, a complex one?
I don't think it's that complex, but there are a couple things that are important to keep in mind. You know, when Donald Trump announced, he talked about, he sort of disparaged, and people took it offensively, that he talked about Mexicans being criminals and rapists and things like that. So
did he? He says it wasn't that. Was he misinterpreted? He says it was illegals from Mexico. You say?
A lot of people who are Hispanic took it as an affront and an attack on them, and sort of saying that. You know, in my role as a journalist, I wanted to cover the news. I think that if you look at, for example, the 2012 election with Mitt Romney, some of the things that he said on immigration were perceived to be taken the wrong way, and so you had Trump going way beyond that, and so that was kind of the situation where people were like, you know, he's saying some stuff. Now it got him a lot of attention, got him a lot of votes, because people who want to be strong on immigration said, you know what, I like this guy. He's shooting from the hip. On the other hand, his favorability with Hispanics nationally just tumbled.
I heard him say many times. I heard him say, Latinos love me. They love me.
He does say Hispanics love him. He does love to use that line. You know, he got very excited when in Nevada the entrance polls for a caucus are very unreliable. You basically are catching people when they're coming into a caucus, which is much different than a primary. And so they showed that he won the Hispanic vote, and he's been excited since then because, you know, he thinks he's going to win the Hispanic vote. The reality is that the percentage of people that are Hispanic that are Republican is a much smaller percentage. So he's winning among this really small percent. And Democrats have in the last few election cycles been getting more and more.
So if he's the Republican nominee, let's assume for a second, fast forward, he's Republican nominee, runs against Hillary Clinton, what percentage of the Hispanic vote does he get?
You know, honestly, if you wanted me to pick a number, I think it would be somewhere in the 15 to 20% range. And so you have to remember, so here's the thing. Places like Pew Hispanic will talk about what percentage of Hispanics are Republican. And it's about a 15 to 20% range. And these are people that are pretty strongly Republican.
So he gets all of them?
Well, I mean, you know, the thing is that Obama got 71% of the Latino vote, and that's really high. And that number has been going up. Yeah. And so I think for a while, you know, maybe Clinton folks were thinking if we were in the 75 range, that'd be great. I mean, if they're in the 80 range or 85, that's huge.
Do you think more Latinos, Hispanics have decided to become naturalized, to hey, I'm in because of this?
I did the first story on that. I went to Nevada, and I was hearing from a lot of people that what they said was, people who had been here 15 years, 30 years, and then they said, well, why are you registering now? Why are you naturalizing now to register to vote? And they said, because to vote against Trump. And I spoke with 4 women who are part of the culinary union in Nevada, a very influential union out there, and they work for Trump. They work in Trump's hotel, and they are naturalizing so they can vote against him.
Wow. Yeah. Is it all about Trump, or are there any other quote-unquote issues that matter from your perspective to the Hispanic
what they
community?
always talk about is immigration is a passion point. It's an issue that people understand. People, there's mixed status families where someone's a U.S. citizen and someone's undocumented within the same family. But so they don't like, Hispanics don't like people talking super negatively about immigration, but like most Americans, jobs in the economy, healthcare, often will be ahead of immigration. It's just that immigration always becomes the issue that people talk about when it comes to Hispanics.
Hispanics are spoken about as a monolithic entity. But there are Hispanics from Puerto Rico, there are Hispanics from Cuba, there are Hispanics from the Dominican Republic, and a bunch of other places. Central America has great impact. All these places where people come from has a great impact, or does it not have a great impact on their political ideology?
I mean, that's the thing. The Hispanic community is not monolithic. About 66% of Hispanics are Mexican, so about 2/3. And so that, Mexican American, there's a little bit more, of a unified front on there. But there's a lot of different countries that Hispanics come from. We're here in New York, where there's a lot of Dominicans and there's a lot of Puerto Ricans. And so in different places, for example, in Florida, where there's a lot of Puerto Ricans, statehood issue of Puerto Rico is becoming more of an issue. And in South Florida, for a long time, there's been the issue of Cuba. And now they're opening up and relaxing the embargo. So different groups have different issues that they care about. And then, of course, when you look nationally, I think where we saw the immigration issue become sort of a unifying thing was where people talked about Arizona's law a few years ago that was very stringent immigration law. And people said, well, I'm not from there, or, I don't have that issue, an immigration issue, but they could sort of see the lines that were being drawn, which is like, if you're pulling someone over, are you pulling them over because you know that they're here illegally, or are you pulling them over because they're Hispanic? And so then people felt that sort of went a bit too far.
From your perspective, in covering these issues for a while now, who would you say some of the most prominent leaders in the Hispanic community are?
That what you're asking actually gets to a point where, in the Black community, for example, if something happens that's crazy, you'll see Jesse Jackson, you'll see Al Sharpton, and there aren't these national Latino leaders because people come from different geographic
Henry
places.
Cisneros matter much?
In different places, right? So Henry Cisneros from San Antonio, Julian Castro and Joaquin Castro now. So it depends, right? And then you'll have like a Mario Diaz-Balart in Florida, who's Cuban. So it's kind of more, they're leaders in their own communities, but there's not like a national leader in that way,
Does that matter?
I think that if you talk to a lot of Hispanic leaders, it does matter because their issues are not front and center, right? So if some sort of tragedy happens and Sharpton goes down there, the cameras follow him, right? And then he gets to make that a national issue. So I feel like in those ways, that's where people feel that they wish that there was more of a Latino leader.
So in New Jersey, where I'm from, Robert Menendez, Senator Menendez, dealing with some issues with the federal government, right? A few seconds left. Does that matter to the Hispanic community?
I think that Bob Menendez is obviously going through his legal issues. I think that before that, he might have been considered a vice presidential pick, because he's been around for a while and kind of gets to the point of what you're talking about, where there's not Hispanic leaders that have been around for a while, and that's why someone like Julian Castro is elevated, even though he's young, and they say this could be the future because there's not a lot of leaders out there.
Adrian Carrasquillo, where can people check out your stuff?
BuzzFeed.com and on Facebook and Twitter.
Listen, thank you for coming in.
Thank you so much for having me.
Keep us posted. We'll have a continued conversation about this very important issue dealing with a growing community that's voting more and more, which is important. Thank you. Stay with us. We'll be right back right after this from Lincoln Center here and at the Tisch WNET studio. Thank you.
Appreciate it, sir.
To see more one-on-one with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato PhD and follow us on Twitter at Steve Adubato.
We are pleased to be joined by Barry Ostrowsky, President and Chief Executive Officer of RWJBarnabas Health. Good to see you, Barry.
Good to see you. Thanks, Steve.
Let's go through this. RWJBarnabas Health, 11 hospitals, 32,000 employees, 9,000 physicians, 2 organizations come together. Very significant, right?
I think it's very significant. The most significant healthcare transaction in the history of New Jersey, to be honest with you. And one of the other metrics that I think is very important was we train 1,000 medical students, residents, and fellows every year. So we're very much in the academic medical space as well as the service space for all of our patients and their families. We have incredible aspirational goals that we want to attain, and creating this new organization is going to allow us to do that.
As we get into the discussion, I want to make sure we disclose a couple things. One, that Barry is a board member at NJTV, and I've done a significant amount of leadership coaching and development at Barnabas.
That's what's made it so great.
Well, you went too far there. Let's talk about this. The merging of organizations, right? Big,
yes.
Significant organizations. Talk about the impact on patient care.
Well, we did this about patient care. One of the things we have to remember is neither of these organizations were desperate for a transaction. We were both very successful financially and, more importantly, very successful clinically. But we thought we could be even better. We could do more for our patients. We expand programs. We can expand our teaching footprint. Those goals are what this new organization enables us to attain. So if you're a patient in our organization at any venue, whether it's a community hospital or a teaching hospital, you now have the ability to plug into a deeper program, more collaboration among experts in those particular fields, and with new technology that we'll be able to introduce because of the resource base.
For example?
Well, now, of course, people are using teleradiography. They're using, in fact, video consultations. More importantly, we're able to get our professionals to confer with each other using technology. So if you have a series of specialists that are separated by an hour-and-a-half ride, we can put them on the screen, they can talk to one another, they can go over cases, and in fact, they can teach using that. So everyone can tune in and have the benefit of a great expert in a particularly narrow field that, frankly, that student or resident may have lived without. All of this ultimately cascades to the benefit of the patient and their families.
Let's talk about some of the challenges, excuse me, Barry, that it creates in terms of communicating throughout a system this large with a footprint this large. How do you communicate with all those employees and 9,000 physicians as well?
Sure, it's a challenge. There's no doubt about it. First of all, the geography we cover includes 5 million people who live in New Jersey. That's more than half of the population of New Jersey. What you just put your finger on is one of the crucial initiatives that we have to satisfy. With 30,000+ employees, we need to be perfectly transparent about why it is we did this transaction, how it's going to affect them. You know, when you do a transaction of this size, or probably any size, there's a level of anxiety among employees about their jobs, about their future, about what's going to happen to their institution. And so I personally am visiting every venue in which we have employees and patients, and I am explaining to the physicians, to the employees, to the trustees, all the background behind the transaction, what they can expect going forward. And of course, we have a robust communications department that has been peppering everybody with all the details about the transaction. I have to tell you, I'm about a quarter of the way through this tour, and the excitement is palpable. People, after we have the discussion, are excited. And of course, that's primarily because we're not laying people off, we're not closing institutions, we're not curtailing programs. This is all about a future state of healthcare for things that we need to accomplish, as opposed to having to correct anything that we've been doing up to date. And I think that builds enthusiasm, it builds confidence, and so our people are very happy. The physicians love the idea that we're going to be doing more research, which frankly is a very expensive commitment.
There's a Rutgers connection?
Yes.
Explain that real quick.
So Rutgers, of course, is a new owner of 2 medical schools after the UMD-NJ merger. And
University of Medicine
and Dentistry of New Jersey. Rutgers is very committed to expanding its research footprint. It already does some terrific research, but it needs to do more. We, as a partner with Rutgers, will be helping them fund and giving them the assets and resources they need to do more research. So NIH grants, which is the typical metric by which universities and organizations are evaluated as to their commitment to research is something that we will be soliciting in much greater volume and for using the resources that we have. So we're going to be one of the reasons that research will expand in New Jersey.
Two other areas I want to make sure we cover. One is the diversity issue. You actually wrote a piece, I believe, for NJBIZ on the issue of women in leadership positions. But the other one is the wellness issue. You and I have talked on the air in previous programs, but also offline in a series of community forums. Wellness, prevention. Go ahead.
Well, everybody talks about wellness. It's a tough thing to define. See, I believe we're in the social service business. I've always believed that. Healthcare, conventional clinical care has been our major product line. You know well, so there are social determinants of healthcare. If you live under terrible circumstances residentially, if the streets aren't safe, if in fact there's not enough nutrition in your diet, if you're not doing exercise, these are the things that have to change. By the way, it's the right thing to do. It's a righteous objective for sure and mission, but we can't afford healthcare without that. People think that this is ancillary to delivering healthcare. It's not.
At the core?
Exactly, it's the core, because no matter how efficient we get in treating illness, unless you are able to have a certain percentage of people avert illness and take the resources that you would have spent on people who get sick who don't need to get sick, we won't have enough resources to treat people who do get sick. So we are committed to be in the neighborhoods, to be in the communities. These are the aspirational goals, frankly, Steve, that really drove this transaction. And by the way, the return on the investment will take generations. So, you know, when you buy an ultrasound machine, you see the results immediately. When you start developing better nutritional programs, when you start talking to people about better lifestyle, when you introduce behavioral health, you're not going to see that for a generation or two. We have to start. And we have to have the perseverance to continue. That's what this organization is going to do beyond anything that's been done before in New Jersey.
The other piece that I said I wanted to mention, by the way, there's a Devils partnership. Real quick, 20 seconds on Devils.
The Devils are New Jersey's only team as we see it. They are committed to community intervention, and we're their partners to do just that.
Executive women in New Jersey, Micheline Davis, a senior executive within the RWJBarnabas health system, taking a leadership position there. Women in leadership positions. You wrote a piece for NJBIZ that talked about this issue, a study that this organization that Micheline's connected to, Executive Women in New Jersey, put out a study. You responded to it. Talk about it.
Well, I'm very committed to, in fact, make sure that women are not limited by this glass ceiling that everyone talks about. They are underrepresented on boards of directors. They're underrepresented in the corner office. They're underrepresented on senior management teams. In our organization, 78% of our employees are women. And up until a few years ago, when Micheline spearheaded the initiative that we had, there really were no tracks to make sure that these women who are equally as committed, equally as smart, if not smarter, very good at their jobs, could get on a professional track to end up in the corner office. We have women running hospitals. We have women, frankly, on our senior management team in a great percentage. We're recruiting women for our boards. So I thought it was important to be able to talk to the rest of the business community and say, look, let's stop ignoring it or just paying lip service to this. Let's do something that is meaningful. And I have to tell you, the response I've gotten from my colleagues in management throughout the state has really been gratifying. I think there's the excuse that's used is you can't find a woman
what do you say to
put on. Well, it's absolutely untrue. First of all, you're looking for a woman who's already been on a board. Yes, there are few of that. How are you ever going to break into putting women on board? There are plenty of women who understand precisely the fiduciary responsibility of a board member, who understand what those obligations need to be. And by the way, it's good for business.
It's smart business.
It's very smart.
You're not doing
business.
A favor to women.
Exactly.
This isn't the PC thing to do. You say.
No. If you're going to run a business that's successful and half the population or more are women, why wouldn't you want women sitting on the highest level of governance in your enterprise? It's just counterintuitive to me. So everyone talks about big data and everyone talks about analytical information. Why not have the people who make many of the decisions? In healthcare, of course, women make most of the decisions. Why shouldn't they be at the board table helping your enterprise be more successful?
You expect this to change in the, you talked about long-term on the wellness before, you got a long-term ROI. You expect this to change?
This will change more quickly, partially because the workforce in all professional organizations now becomes more women, has become more women, and I don't think women are going to have the patience to wait for political correctness. They deserve it, and they need to be put there.
All right, last question. Barry was good enough to sit for another conversation we had on this book I've talked about before, Lessons in Leadership, and you've talked to me about your #1 leadership lesson, but I need to spin it this way. You've talked about women in leadership. Mm-hmm. Do you believe in any significant, meaningful way most women in a leadership position would lead any differently than men? And if so, how?
I think they'd probably be better. I have to tell you something, one of the things I respect the most, we're not going to change necessarily the whole family organization, so we have women who are important executives who are able to balance their obligations at home, their obligations in family life, and still do terrific jobs as executives. Somehow, a gender-specific talent of being able to do all this balancing and get it right and ask the questions and understand it, I think we couldn't be a successful organization. I speak for ours. We couldn't be a successful organization without the women we have in incredibly important roles running big chunks of our company. It's a $5 billion company. We have plenty of room for talented and skilled executives, and the women we have and the new women that we'll be introducing into those roles will make us a better company.
By the way, go online, not just on our site, but go online to the NJBIZ. There are media partners as well. NJBIZ.com site, you'll see Barry's article on this topic. It's important reading. Barry Ostrowsky, President, Chief Executive Officer, RWJBarnabas Health. Thank you, Barry.
Thank you, Steve. Great to be here.
Stay with us. We'll be right back from the Tisch WNET studio here in the heart of Lincoln Center in New York City.
To see more one-on-one with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato PhD and follow us on Twitter at Steve Adubato.
We're here with Dr. Kulkarni, who is one of the honorees tonight. Your area of expertise is?
Cardiology.
You know, it's interesting. As a clinician, you're great at what you do, but you're recognized as a leader in the healthcare field, but also one of the top 50 women from NJBIZ. What does that mean to you?
It means a lot to me because, medicine is getting to be a business now. It is getting multifaceted. A lot of business concepts we have to integrate now. Medicine is changing. This was a very nice but a little unexpected honor. When they called me, I'm like, are you sure? I'm a physician.
But it felt great.
It felt great. It felt great. They said, you have 2 big practices, 2 big offices, and a staff of 100. We think it's medium-sized business. I was very honored. Thank you.
Congratulations.
Thank you very, very much.
We're here with Yin Rani, who is Vice President, U.S. Marketing, Campbell Soup Company, one of the 50 best women in the state. The event's about to start. You hear the bells, the lights are going down. What does tonight mean to you?
I mean, it's a huge honor to represent a great company in a great state and to be recognized as in a company of other great women with so many advances have been made and still so much progress to be made on the issue of women leaders.
The keys to being a successful woman in leadership, what would they be?
Be true to yourself, be brave, never be afraid.
Well said, thank you.
Sure.
We're at the NJBIZ Best 50 Women in Business event, and we are here with Allison Larena, who is President and CEO of the Mayo Performing Arts Center, which is?
In Morristown, New Jersey. We're a 1,300-seat performing arts venue.
Talk about this award and what it means to you.
Well, I am just thrilled and honored to be here tonight receiving this award. I have personally been involved with nonprofit theater management for more than 20 years, but really it's a recognition of the Mayo Performing Arts Center and all the wonderful, wonderful work that we do collectively. We have a great team of volunteers, trustees, and staff members that work hand in hand with so many people in our community to make the theater such a success.
Allison, talk about, in your opinion, the keys to successful leadership for any woman.
For any woman, it's basically hard work, like anyone. And also, I think one of the greatest things is just be true to yourself and your goal. I believe in the theater's mission. I've always, loved what I do. And I think loving what you do is first and foremost. And then after that, I feel like success comes pretty easily once you love what you do and you work really hard at it.
Is it more challenging, more difficult for women to lead than men, in your opinion?
In my opinion, no, it's not. It's really not. I think
all the juggling and the balancing you have to do?
We do. We have a lot of juggling and balancing to do, but if you have a great support team behind you, in your family and at your workplace as well, I think that even though it's a struggle sometimes, it's all well worth it every day.
And the number one leadership lesson you've learned so far is?
Oh gosh, that's a tough one, but the number one leadership lesson is really be kind, be good, be fair, and really be all-inclusive. Everyone at my job and at that theater is part of our family, and they're very, very important people.
Well said. Thank you so much. Congratulations, Allison.
Thank you, Steve. Nice meeting you.
One on One with Steve Adubato has been a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence. This special edition of One on One with Steve Adubato is brought to you from the Tisch WNET studios at Lincoln Center. Funding has been provided by Bank of America, New Jersey City University, ADP, the Russell Berry Foundation, PSE&G, Qualcare Inc., and by New Jersey Sharing Network. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.
Hi, I'm Peter Rooney. In 2006, I lost my father to renal disease. He was on the waiting list for a new kidney, but did not receive one in time. Unfortunately, so many like my father have lost their lives while waiting for a life-saving organ. At New Jersey Sharing Network, we're committed to saving and enhancing people's lives through organ and tissue donation and by informing people about this important decision. Because you can make a difference and save a life.